So this is a presentation on the Diversional Tactic Toolkit in the Neurocognitive Population. So the purpose of this presentation is to discuss dementia and neurocognitive disorders are increasing across the nation, according to the Alzheimer's Association. And acute hospitalization may exacerbate behavioral symptoms, even in patients with mild neurocognitive disorders. So the purpose of this is to standardize the practice among RNs while increasing the knowledge and comfort. So the objectives of this presentation, we are going to explain the basics of the neurocognitive population, discuss the appropriate non-pharmacological diversional tactics that you can use with these patients, and then evaluate and document the effectiveness of the diversional activities that you choose to use. So to discuss the neurocognitive population, a major neurocognitive disorder is characterized by a significant decline in at least one of the domains of cognition. So this can include executive function, language, memory, complex attention, learning, perceptual motor, or social cognition. There's 4 different types of dementia, and those include Alzheimer's, Lewy body, frontotemporal, and vascular, with Alzheimer's being the one that accounts for the majority of those diagnoses. But neurocognitive disorders can also include Parkinson's disease and traumatic brain injury. So why are non-pharmacological interventions so important? So the first is poor outcomes. So neurocognitive patients may have psychoactive medication use, restraint use, violent episodes, and staff or patient injuries. And using these non-pharmacological interventions can prevent some of these poor outcomes. There's also the potential for medication interactions. So polypharmacy is a significant issue in the neurocognitive population, and medications for mental health, sleep, acute or chronic illness may interact with one another. And then truly, according to research, the non-pharmacological interventions that we utilize are considered best practice in the neurocognitive population when treating behavioral issues. So the different behaviors that are included in the neurocognitive population that may give you a sign that it's time to utilize these diversional tactics include anxiety, mild agitation, pacing and fidgeting, wandering, pain, sleep disorders, and change in routine.
So acknowledging the exceptions. So severe agitation may be temporary, but the goal is to prevent the level of escalation in behaviors, but remember to keep the staff safe as well. Violence may the appropriate and safe decision for the staff and the patient themselves. The acute illness in itself is not an exception, as behaviors may be exacerbated, even in those patients with mild issues in the past. However, treat the patient's illness as appropriate, such as blood pressure, temperature, fevers. And end of life, actively dying patients, these are some of the exceptions. Just remember to continue assessing patients during these situations and the exceptions, and it's not all the rule. So how do you know what to try? Patient-centered care is the most important first step in caring for patients with neurocognitive disorders per Alzheimer's Association. During admission and assessment, is there anything special that the family can tell you about the patient, can help the patient, take care of the patient better? The About Me poster that's created by the Rec Therapy in the patient's room has great information that can help you take care of the patient better. And again, family members, they may be able to tell you a little bit more about the patient. And care plan, this is updated per shift and can be beneficial. And the leisure interest board that is located in the day room. And just trial and error. Don't be afraid to try something new. If it doesn't work, try something else. Diversional tactics and activities. These are just some of the things that we have seen on the unit and have proven to be effective. So the county diversional kits, dolls and pets, ambulation, music therapy, tinkering toys, the busy board, buttons and fidgets. Other activities by the organization includes cleaning, laundry, or sorting tasks, coloring, weighted lap pads, books and magazines. So where can you find the appropriate activities? Pod 1 day room, the leisure board's interests are located on the back of the wall under the cabinet. Books and magazines in the cabinet, coloring, TV and music therapy. And Pod 2 day room, that's where the diversional kits are located, the dolls and pets, and the weighted lap pads. Care planning, use your care plans, see if there are tips and tricks, your care plans, and update your care plans per shift. That's where you can find what works and what doesn't work. Additional resources you can utilize is our resource sheet that's hung in Pod 1 day room and Pod 2 day room. The badge backer cards that's provided to all nursing staff. The unit website. The leadership team on the medical specialty unit. And the Alzheimer's Association website. And these are our references. Thank you.